Welcome back to First Move. Finding ways to safely welcome tourists remains a struggle for many countries around the world. And for more than a month now, Sri Lanka in South Asia has been avoiding strict quarantine lockdowns. Travellers, though, must stay in approved hotels for the first 2 weeks. They must travel independently, be tested, and crucially, they can't mingle with the locals. Hotel staff, drivers and tour guides follow their own quarantine rules. Kimarli Fernando is chair of the Sri Lankan Tourism Development Authority and joins us now. Kimarli, great to have you with us. This is definitely an innovative way of revitalising the tourism industry. Just explain to us further how these bio bubbles work.
Thank you. Thank you for having me. So basically the bio bubble works is that we've certified hotels as safe and secure. We have KPMG and Ernst & Young's certifying them because it's quite a strict protocol. The hotels are certified and the guides, drivers as well are certified. So everyone is trained in the hotel tourism sector. There are about 200 hotels that have opened up based on that all over the island. And how it works is that you book your airline ticket. You can book directly to the hotel or the travel agents or through the OTA. You visit Sri Lanka. You have an itinerary, whatever the itinerary you wish to have. You can visit about up to 20 sites in Sri Lanka all over the island, including the heritage sites, that is Sigiriya, the ancient city of Anuradhapura, Polonnaruwa. You can go whale watching. So lots of sites available. And you would go to those sites without mingling with the local community. So it's not a strict quarantine at all. There is no minimum mandatory stay requirement. So you can stay as many days or as little days as you'd like. You can use all the facilities of the hotel. You can go to the beach because the beaches are demarcated for you. So you can use all the facilities of the hotel. So it's not a strict quarantine. And you would proceed in a bio bubble. So actually what we have done for the last 1 year or so is that the country took immediate action when we had before we had the first patient of COVID. So the quarantine centers were set. So early action was taken. And by May last year, we actually opened up for domestic tourism. So this year, in January 21st, we opened the airports again. Of course, the airports were never closed, but opened the airports for international tourists on the 21st of January.
So it's early days, clearly, but what kind of reception have you had in terms of bookings, even just compared to what we were seeing perhaps this time last year? Are people actually booking, or is it just a case of people trying to understand how exactly it's going to work and what freedoms they're going to have and how safe they are?
Actually, people are already booking. There is particular markets we found, the GCC, Dubai, Emirates, that region, in Russia, that region as well, Ukraine, Kazakhstan, and so on. We had visitors from Germany, particularly for Ayurveda. So we've had visitors, and actually, it's been a few weeks only. But the COVID positive guests were like 4 or 5 out of several thousands. So we are seeing a lot of traction, and what's really encouraging is that the airlines have increased their scheduled flights. In fact, new airlines, 5 or 6 new airlines already have committed and started flying already to Sri Lanka. Sri Lanka being an island, we are connected with the flight connectivity, of course, is really important. Yes. And we are really encouraged with that.
And I know you have the hotels running at 75% capacity. So for those individuals that do test positive, they can actually quarantine in these hotels if they don't have symptoms or a hospital. What about things like health insurance? Do you demand that people have health insurance? Because if someone does come and they're sick and they need help or they need support in your country, then they have to pay for it. Are you demanding that they buy that in Sri Lanka, or they come with that?
Yes, actually what we are making mandatory is that you buy an insurance with us for $12. That would give you 50,000 cover insurance cover for 1 month. We've been commended for that because actually the $12 you pay covers everything in the case that you are COVID positive. As you correctly said, if you are COVID positive and non-symptomatic, you would remain in your hotel. However, you'll not be able to use the facilities of the hotel, right? But if you are COVID positive, from the moment the insurance will kick in, from the ambulance to the hospital to even if they are intensive care or all the tests, laundry, everything will be covered. So a guest should not worry. When you pay the $12, everything is taken care of, even in the very unfortunate event, if there is even a death, all that is taken care of. So we have made that mandatory, and I think it's useful to our international tourists because they don't have to then worry about anything.
100%. Very quickly, I know that the nation's also just started to vaccinate people with a focus on the tourism industry. Obviously, in this case, once those tourists, that batch of tourists leave, there's a 2-week quarantine. How quickly are you anticipating getting people that work in this industry vaccinated? Do you have any sort of sense of timing? Because this clearly is crucial, not only for the workers to be able to continue working consistently, but also for their protection and safety.
Absolutely. Already the data of all the certified hotels have been sent to health, the tour guides, travel agents, drivers. So the data is already collected, and within the next few weeks, we'll be vaccinating all of the tourism industry.
Fantastic. Well, we applaud your innovation, and we'll see how well it goes. And I have to say, watching that video just makes me want to go on holiday. Just want to travel again. Good luck with it. Thank you so much for sharing what you're doing there. Kimarli Fernando, Chair of the Sri Lanka Tourism Development Authority. Great to chat to you. All right, the market opens next. Stay with us.